Welcome to this explainer. Today, we're unpacking a rapidly growing, yet almost completely invisible threat that's literally hiding right in plain sight. We're going to dive deep into Dr. Alja Marjanaen's recently completed doctoral research from the University of Oslo's Department of Geosciences. What we're looking at is why extreme urban heat is becoming this massive, compounding danger to public health. You know, we usually think of climate change as rising sea levels or massive destructive storms, right? But this research forces us to look right at the pavement beneath our feet. So let's jump straight into the data and see what is actually happening in our urban centers.
Okay, let's kick things off with a pretty intense question. Is your city quietly turning into an oven? Because the reality we're facing is that recent European summers have fundamentally transformed our concrete environments into active danger zones. When the sun beats down, our built environments don't just, sit there and endure the weather. They actually change it. They actively amplify the heat. We're seeing a massive shift where the city itself becomes a physical hazard to the very people living inside it.
And we aren't just talking about a couple of uncomfortable, sweaty afternoons here. We're seeing unprecedented, prolonged extremes on the ground. Think about this. In parts of Finland, there were 22 straight days of temperatures above 30 degrees Celsius. In Spain and Portugal, temperatures soared to a staggering 46 degrees. The heat got so intense in France that they literally had to close schools and even shut down the Eiffel Tower because forecasts were hitting 41 degrees. These are systemic, continent-wide heat waves.
Now here's where it gets incredibly serious. The human cost attached to these soaring temperatures is staggering. This isn't just a matter of needing to run the AC a bit longer. It's a lethal public health crisis. A scientific study cited in the research estimated that over 60,000 deaths across Europe between May 30th and September 4th of 2022 alone were directly related to heat. 60,000 people. That number absolutely demands that we stop treating a heat wave as a mere inconvenience and start treating it like the severe health emergency it really is.
So why cities? Why are urban areas taking the absolute brunt of this crisis? Well, to grasp that, we have to understand a phenomenon known as the urban heat island effect. Dr. Marjanaen points out that the very physical infrastructure of our cities, think of the dark, impervious surfaces like asphalt and concrete all around us, well, they absorb the sun's heat rather than reflecting it. It's like a giant heat sponge. This traps the heat, making cities substantially and measurably warmer than the rural or suburban areas right outside of them. Our infrastructure is quite literally multiplying the danger.
All of those trapped rising temperatures build into two very specific public health challenges. First up, we have the direct health impacts. This is the biological harm happening to the body. It ranges from mild discomfort to fainting, exhaustion, heat stroke that requires hospitalization, the worsening of existing diseases, and, as we've seen, premature death. It can even cause severe mental health depreciation. But beyond that direct physical harm, we also face massive indirect impacts. These are the systemic shocks. Heat waves can actually increase the transmission of communicable diseases, severely strain our hospitals and emergency services, trigger droughts and fires, and drastically worsen air quality for everyone.
When we investigate the victims of this silent killer, a truly chilling demographic trend emerges. In 2022, among the 0 to 64 age group, there were roughly 4,800 deaths. That number jumps to 9,200 deaths for folks aged 65 to 79. But then, consider the 80-plus category, over 36,000 deaths. The risk of mortality doesn't just slowly creep up as we age, it absolutely skyrockets exponentially. Senior adults simply struggle immensely to cope with these unusually high temperatures.
Furthermore, the statistics expose another striking disparity that you really might not expect. Women accounted for 63% of these heat-related fatalities, compared to just 37% for men. This underscores a vital theme running right through Dr. Marjanaen's research. Extreme heat absolutely does not affect everyone equally. There are underlying biological and social dynamics at play here that make certain demographics far more susceptible to extreme temperatures than others.
And that brings us to a crucial concept at the absolute center of this research. It's called vulnerability. Vulnerability is commonly defined as a function of exposure, sensitivity, and adaptive capacity. Basically, what that means is your risk level is dictated by your individual characteristics, things like your age, your sex, your socioeconomic status. Some people inherently have a lower physical tolerance for heat, while others simply lack the resources to adapt. For example, maybe they don't have access to air conditioning, or they're unable to easily leave a sweltering environment. Based on that definition of vulnerability, Dr. Marginian identifies specific groups of people as having a much lower tolerance for extreme heat. Older adults, small children, pregnant women, and people with chronic disabilities face really severe biological risks. But we also have to look at socioeconomic vulnerability. We're talking about homeless individuals living outside without shelter, and workers engaged in physically demanding outdoor jobs who simply cannot just decide to escape the heat. These are the populations that require immediate prioritization the second those temperatures start to rise.
Fortunately, we can fight back. The research is super clear that local governments have got to take the lead. Here's a breakdown of the specific logistical and healthcare strategies that municipalities need to execute. It starts with issuing really timely alerts so people actually have time to prepare. Then, it's all about infrastructure, ensuring the public has easy availability of drinking water, like setting up fountains in city centers, and managing heat stress in public buildings. Finally, healthcare systems have to adapt by temporarily increasing their emergency room staff and providing specific training and equipment to manage a sudden influx of heatwave victims.
Now, obviously, reducing global greenhouse gas emissions by transitioning to renewable energy like wind, hydro, and solar is the overarching global goal. But emission reduction alone is not enough to counteract the impacts we are already living through today. Cities have to physically adapt for the future. One of the single most effective localized measures we can take is increasing forest areas and green spaces right within the urban landscape. Doing this helps to naturally cool the city down, combating that urban heat island effect, while simultaneously dropping urban air pollution. It's a win-win.
But on a personal level, what should you actually take away from this? Well, you can protect yourself and your family by adopting some highly effective individual coping routines. When a heat wave strikes, you've got to alter your daily routine. Avoid outdoor activities during the absolute hottest parts of the day and try to stay in the shade. Drink plenty of water to maintain hydration, and seriously, don't wait until you're already thirsty to take a sip. Reduce your physical activity levels and make sure you are actively cooling your home by increasing ventilation and drawing the shades to block out the sun. These simple steps can absolutely alleviate mild discomfort before it turns into a severe medical reaction.
Dr. Marginian puts it perfectly. She notes that the ultimate consequence of heat danger is premature death, and avoiding mass fatalities requires us to be exceptionally proactive. We have to develop comprehensive heat health action plans. But crucially, and this is key, we must include those vulnerable groups in the actual development and implementation of these plans. We have to make sure we're specifically empowering the exact people who face the highest health risks.
So as global temperatures continue to climb, and as the concrete around us absorbs more and more of that energy, I want to leave you with this final thought. Think about the very streets you walk on every single day. Think about your neighbors. How prepared is your city, right now, to handle the next extreme heat wave? It's a question we all need to be asking our local leaders, because this silent killer, it's already here. Thank you so much for joining me for this explainer, and definitely stay cool out there.